Right. Okay. Let's start with listening part A. Okay. So in listening part A, you will be listening to two completely different consultations, and they will be giving you 30 seconds to go through your questions, which again your questions are again fill in the blanks, and you need to as you listen, you need to fill the gap. So before they start the audio, for each consultation, they will give you 30 seconds to go through your questions. During this 30 seconds, you need to do something called prediction. How do you do prediction? You start with the headings on the side. On the side, they will give you some headings. Start with that, because those headings will give you the structure of the consultation. It will tell you what are the things that's being discussed in this consultation. Okay, then you go through each question. You analyze each gap fill, and based on the words before and after the gap, you try to predict what's going to be your answer. You have 12 questions for each consultation. So you go through 12 gap fills during your 30 seconds preparation time. Okay. And remember, the headings give you the overall idea of the overall structure of the consultation, and the gap, when you go through each gap fill, that gets you based on the words before and after the gap, you think about what type of word is going to be the answer. So this way, you're able to familiarize yourself with an audio that you have never listened to. That is the purpose. Okay. All of you go through what I've written on the screen. Come on. All of you. Okay. So let's start with today's part A. Here we go. All right. Right. So Reshma, can you unmute yourself and read the scenario for me today? This one.
Okay, ma'am.
Yes. Just a scenario.
You hear a primary care physician talking to a new patient called Jason Weiss.
So here, a primary care physician, a doctor, is talking to a patient called Jason Weiss. Okay, Jason Weiss. Okay. Now let's start with the heading. So Reshma, can you read the first two headings for me?
Okay, ma'am. Patient, onset of condition.
So after mentioning the patient's name, the audio moves on to onset of the condition. Onset means start of the condition. How did the condition start? So whatever the problem the patient has, how did it start? So of course, they will talk about when it started, the symptoms, the description of symptoms, the frequency of the symptoms, the duration of the symptoms, the treatment tried, the diagnosis, the test that they underwent, all those things. Start of the condition. Onset means how did the condition start? Okay. Now, next heading, Reshma.
Pulmonology referral.
Pulmonology referral, which means the patient was referred to a pulmonologist, and what happened? Pulmonology referral. So again, referral to a doctor means the doctor's diagnosis, what tests the doctor asked the patient to undergo, what were the problems that they found out from the test, what they did not find out, all those things. Okay. Next one. One second. Yeah. Next heading.
Current symptoms.
So what are the current problems that the patient has? Okay. And finally,
family history.
Family history. So current symptoms means again the symptoms, the duration, the frequency, the description of the symptoms, and what treatment they tried, everything, or what treatment they are taking right now. Then family history, of course, about their family, any other issues that the family members have, any other health condition, all those things. Okay. One second, please remember the sessions are being recorded. This is a request from my side, which I really hope that you guys keep in mind. The sessions are being recorded to be uploaded on our website. So be mindful of your other classmates as well. So if you have a lot of background noise, make sure to mute yourself. And if you're unable to speak, utilize the chat. Okay. All right. So all of you take a second, go through the structure of the whole consultation here. Please go through it. Start of first, they talk about the patient's name, then start of the condition, then pulmonology referral, then current symptoms, finally family history. All of you go through it. Come on. Okay. All right. Go through it. Come on. Right. So let's start with the first question. Betty, can you read the first question for me, please? 13th gap fill. Yes. 13th question.
Yes, ma'am. Breathing difficulties. dash sensation in chest.
Breathing difficulty. So when they talk about onset of the condition, when they mention onset of the condition, we need to figure out when they talk about breathing difficulty, dash sensation. So what's going to be our word? The word, what type of word will come as the answer? Dash sensation in chest. It means
Type of sensation.
very good, type of sensation. So here we are looking for a type. What type of sensation? What type of sensation in the chest? Okay. All right. So when the patient talks about breathing difficulties, we need to figure out what type of sensation in the patient's chest. Okay. All right. Next question as well, Betty.
Left with a persistent dash.
Okay. Left with a persistent dash. Persistent. What do you mean understand by the word persistent? What does that persistent mean?
Continuous move.
Continuous, constant. Something that does not go away. It's always there. Remember, continuous, constant. So they might not use the exact word as persistent. They might use some other word. Continuous, constant, something that's always there, something that's not going away. Always there. Okay, something that's not going away. So left with a persistent dash. So what type of word will come as come in the gap? What type of word? Persistent what? What type of word?
Some symptom, ma'am.
Symptom. So we are looking for a symptom that is persistent. That is persistent. All of you go through the two questions. Come on quickly. Okay, Shravani, can you read the next question for me?
Subsequent difficulty dash and acid reflex nighttime.
Subsequent difficulty dash and acid reflect nighttime. So again, remember anything given in bracket, the order can be different. Okay, bracket, if any information is given in the bracket, remember the order can be different. They might mention nighttime first, then they might mention acid reflux. Okay, that is there. Then one more thing. Here, as you can see, they have listed. They have mentioned items using and. So this is a list, 1 and 2. So this is a list. So remember, in a list, the order can be different. Okay, they might mention the acid reflex first, then they might mention the next thing. So here, I want all of you to go through it. Here, subsequent difficulty dash. So we are looking for name of a
Active.
I need answers. Difficulty. After difficulty, if there is a gap, what are we looking for here?
Some symptoms.
And some action.
Some problem. Okay, action or problem. Some problem. Okay, or action. Okay, let me tell you one thing. When you have difficulty before the gap, I need your full attention. Then you can expect a noun. Difficulty, noun, name of something. Or, one second, if it's a verb, remember it will be in ing form. Difficulty breathing, difficulty walking, difficulty running, it will be in ing form. If it's an action word, it will be in ing form. Okay, so either after the verb, this one difficulty, you can get a noun or you can get a verb. If it's a verb, if it's an action, it is going to be in ing form. Okay, all of you go through it. Come on. Go through it. Next one, Shravani, can you read the next one?
Diagnosed with dash and mild GERD.
Diagnosed with dash and mild GERD. So what's going to be your answer? Name of
Condition.
Condition. Name of a diagnosis or a condition. Name of a diagnosis or a condition. And remember, they've used and. They've said it's a list. When you use and to mention items together, that's called a list. So remember, the order can be different. The mild GERD can come first. Then after that, you can get your answer. So you need to be very careful. Okay. All right. Now, next question. Next one. Okay. All right. Okay, Anu, can you read the next one for me, please? Under pulmonology referral, yes. If it's okay, unmute yourself.
Yes, ma'am. Pulmonology referral, dash early stage pulmonary fibrosis ruled out.
dash and early stage pulmonary fibrosis ruled out. Okay, can I ask you guys something? What is the meaning of ruled out? Ruled out mean?
Confirmed.
No, it's not confirmed. It means excluded or eliminated. Find out. No, wrong. Even for your writing, remember, ruled out does not mean find out. It means excluded or in a simple terms, eliminated. When you rule out something, you are excluding that thing. You are removing that from as an option. So it does not mean find out. That is wrong. That is your wrong understanding. Ruled out has nothing to do with find out. It does not mean find out. It means excluded or eliminated. So dash and an early stage pulmonary fibrosis ruled out. So what is going to be the word here? What type of word will come as your answer? What type of answer? Name of a disease condition. Yes, name of a disease condition. Condition. Okay, we are looking for a name of a condition. Okay, next one, Anu.
Dash identified in lungs, mild COPD diagnosed.
Dash identified in lungs, then that led to mild COPD diagnosis. So what are we looking for here? Do you think it's a positive thing that they identified in lungs?
No, ma'am.
No, ma'am.
So they have identified a problem in lungs. What is that problem in lungs? That led to the mild COPD diagnosis. So here we are looking for a problem in lungs. Okay, all right. Ginu, can you read the next one?
Yes, ma'am. Report being a dash in childhood.
Report, so the patient is reporting being a dash in childhood. Being a dash. So when I say being, so for instance, he reported being a footballer when he was in school. He reported being a rank holder in school, or he reported being an artist. So after being here you're looking for being what? Being a what? It can be a role. Usually it's a role, some role, something that they do. A role in their life. So something, it can be something as, as I told you, an artist, a footballer, a sports person, a teacher, a performer, whatever it is. Okay, so this is the role, a person's role. Okay, being a what? Okay, so all of you go through it. All right, okay. In childhood, remember, in childhood, and again, in childhood is a time reference. Remember, whenever there is a time reference, the order can be different, which means here, the time reference is at the end of the sentence. So in the audio, it can come at the start. They can say, in childhood, I was a dash. Okay, so here they have ended the sentence with childhood. In the audio, they can start the sentence with the childhood. So be very careful. Whenever there is a time reference, the order can be different to what's given in the booklet. Okay, all right. Ginu, next question.
Yes, ma'am. Joint pain initially in dash, but now more widespread.
Joint pain initially in dash. So after in, what do you think he comes here? Tell me. What type of word?
Name of the body part.
Body part, location basically, right? Location, where? Joint pain, where? Initially means, what another word is for there for initially? Tell me.
Firstly.
At first, okay, firstly, at first, okay, what else? What else? Come on.
Begin.
In the beginning, okay, in the beginning, okay, at the start, all these things are correct, okay? So you need to be very careful, beginning, at the start. Okay, so you're looking for a location of the pain that was in the start. Initially, where was the location? Okay, all right. Okay, let's move on to the next one. I need your full attention. Work with me here. All right. Ritu, would you mind unmuting yourself and reading the 22nd point here?
Yes. Treated with analgesia.
No, yeah, correct. Go ahead. Can you read that again? I'm sorry for interrupting. Yes.
Okay. Treated with analgesia plus.
Here plus means and. So we are looking for treated with analgesia and. So we are looking for what? Name of a? Medication or a treatment. Name of a medication or a treatment, right? Form of treatment or therapy for that matter. Some type of therapy, that's fine. Next one as well, Ritu.
Okay. Sedentary lifestyle, work as a dash.
Sedentary lifestyle, works as a dash. So what are we looking for? The patient's
Name of the
job, patient's job. What's their job? Okay. All right. Okay. We have 2 more questions to go. Sony, is it okay for you? Would it be okay for you to read the last 2 questions? Unmute yourself if it's okay.
Yes. Father deceased, emphysema, maternal grandmother had dash.
Maternal grandmother had us. Who is the maternal grandmother? Can you guys tell me maternal grandmother means?
Mother's grandmother.
Mother's mother.
father's
Okay.
mother.
Correct. Paternal grandmother means father's mother. So be very careful. The maternal grandmother means mother's mother. Okay. So, grandmother from the mother's side. Okay. What are we looking under family history? They have given maternal grandmother had dash. So what are we looking for here? Name of a
Disease condition.
name of a condition or a problem. Condition or a problem. Very good. Last one as well, Sony.
Mother recently diagnosed with dash.
We are looking for diagnosed with name of a
Condition.
condition. All of you take a second before I play the audio. All of you, this is pretty straightforward. All of you go through all the questions here. Come on, get ready, go through it. Again, this is a very much authentic OET material published this year. So I want all of you to go through it. Come on. Okay, go through the remaining. Okay, let me just zoom in and you guys get ready because we are going to listen to the audio and try to figure out the answers. 1 second, let me arrange the screens correctly so you can it's visible to you while listening to the audio. Give me a second here. Yes, okay. All of you get ready. We are going to listen to the audio. 1 second. Okay, let me share the audio to you guys. Okay, here we go. Get ready. Let your screens load. Okay, first check whether the audio is audible. All of you check whether the audio is audible.
Extract 2, questions 13 to 24. You hear a primary care physician.
Was that audible?
Yes,
ma'am.
Yes, ma'am.
Perfect, perfect. Get ready. Let me check. Let me play the audio. Get ready.
To the area.
Get ready. Yes.
So, Jason, I understand you've just moved to the area. I've got some notes here from your previous doctor, but it would be good to hear things from your perspective. Perhaps you could start by telling me a bit about any illnesses or treatment you've had, and anything else it might be useful for me to know.
Well, my current problems all started about 18 months ago. I went down with a bad cold that quickly turned into a chest infection. I thought it was just a bug that was going round, but it was quite bad, and I was having problems breathing. It's hard to describe, but I had a sort of stinging feeling in my chest whenever I breathed in deeply. Anyway, I did gradually get better, but I was left with a dry cough. I just couldn't seem to shake it off. It wasn't there all the time, but just when I thought I was all back to normal, it would suddenly re-emerge. That happened a number of times. After that, I started to get other symptoms. I'd lost quite a bit of weight without even trying. I noticed that my trousers were getting really loose, but I was eating normally. And I was sometimes getting this strange feeling in my throat, as if I wasn't swallowing properly. Then, at night, I'd suddenly wake up with a really bad taste in my mouth. Anyway, I went back to the doctor about that and was told I had a hiatus hernia, as well as a mild case of GERD, but not to worry about it. But when I mentioned that I was still getting the chest problems, she decided to make a referral to the pulmonologist.
And did you have some tests?
Yes, a number actually. The first one I had showed I didn't have asthma. I didn't really think that I would have, but they explained how they needed to rule it out. I also had a high-resolution CT scan. I think they said they wanted to see if I'd started to show signs of pulmonary fibrosis, but again, that came back clear. What it did show, however, was that I had hyperinflation in my lungs, and they came to the conclusion that it was probably mild COPD. I was asked lots of questions about my lifestyle, now and in the past, particularly about smoking, and, of course, my father loved his pipe, so I guess I was a passive smoker throughout my childhood. I've never actually smoked myself, though.
That's good. And recently you've been getting other symptoms?
That's right. I've been getting pains in my joints. It was just the odd twinge initially, but it's been getting progressively worse. It started off in my knees, but I'm now getting the same sort of feeling in my wrists and ankles. I've been going to physical therapy and taking painkillers, but I've not noticed any great improvement. But you see, I'm a train driver, so I'm not getting a lot of exercise, and that doesn't help. When I was younger, I used to do a lot of skiing, but I had to give that up after I fell and broke my thigh about 5 years ago. I was lucky I didn't need surgery, but I was out of action for months. At first, I thought the joint pain was related to that, but now it's spreading, I'm not so sure.
And what about the rest of your family? Any health issues there?
Well, my father eventually died of emphysema, and that is a cause for concern. But I should also tell you that my grandmother on my mum's side had pernicious anemia. I'm aware that there's a family weakness there, on the female side at least, because mum's just been told she's got leukemia. That was a shock because it just showed up in a blood test. She's had no symptoms. I mean, it can't be very advanced, but it is worrying. Anyway, the rest of the immediate family are fit and well as far as I know.
Well, thanks for all that background, Jason. What I'd like to do...
Okay, all right. So we have gone through the OT. Let me just admit a few people. Let's start. All of you get ready. We are going to look at the answers. Get ready. Let me arrange your screens and arrange the audio. Give me a second. Right. One second. We'll check the answers. Give me a second. Right. Okay, give it a second. Give it a second.
Understand you. So,
Okay. So what did you guys get as the answer for the first one? What problem, what sensation did he have in his chest? Please tell me.
Stinging.
Stinging. Okay, I want all of you to look at the spelling of stinging. The other one with K, it means different. Okay, this is the spelling here. Okay, stinging sensation in chest. Okay, it's like something poking sensation. That's what we call as stinging sensation. Okay, not the one with STINKING. That refers to the smell. This is not that. This is stinging sensation. Okay, are all of you clear? Next one, 14th one, left with a persistent dash.
Dry cough.
Dry cough. Very good. Very good. All of you got the correct answer. Okay, next one, subsequent difficulty that comes with acid reflux. What is that?
Swallowing.
Swallowing. All of you go through it. See, after difficulty, when there is a verb, it's in ing form. Swallowing. Next one, diagnosed with dash and mild GERD. What was the problem here?
Hiatus hernia.
Hiatus hernia. So let's check these many answers. I need your full attention. Here we go.
Jason, I understand you've just moved to the area. I've got some notes here from your previous doctor, but it would be good to hear things from your perspective. Perhaps you could start by telling me a bit about any illnesses or treatment you've had, and anything else it might be useful for me to know.
Well, my current problems all started about 18 months ago. I went down with a bad cold that quickly turned into a chest infection. I thought it was just a bug that was going round, but it was quite bad, and I was having problems breathing. It's hard to describe, but I had a sort of stinging feeling in my chest whenever I breathed in deeply.
So when it's hard to describe, but I had a stinging feeling in my chest whenever I tried to breathe in deeply. So stinging.
Anyway, I did gradually get better, but I was left with a dry cough.
I gradually got better, but I was left with a dry cough.
Couldn't seem to shake it off.
So instead of saying persistent, he says couldn't seem to shake it off. Couldn't seem to shake it off. Shake it off means get rid of. He was unable to get rid of it because it was so persistent. So that's what he mentions as persistent. See, all of you go through that. Instead of saying persistent, he says couldn't seem to shake it off. He was unable to get rid of it because it was always, he was not able to get rid of it. Okay, so that's what that means. So let's move on to the next one.
Wasn't there all the time, but just when I thought I was all back to normal, it would suddenly re-emerge. That happened a number of times. After that, I started to get other symptoms. I'd lost quite a bit of weight without even trying. I noticed that my trousers were getting really loose, but I was eating normally. And I was sometimes getting this strange feeling in my throat, as if I wasn't swallowing properly. Then at night,
So he was getting some weird feeling in his throat, like he was not swallowing properly. So difficulty with swallowing.
I'd suddenly wake up with a really bad taste in my mouth. Anyway,
So at night, see, night came first. At night, I would suddenly wake up with some, the feeling of acid reflux. Okay, so that's what that is. Let's listen to the next one.
I went back to the doctor about that and was told I had a hiatus hernia, as well as a mild case of GERD, but not.
So he went back to the doctor and he was told that he has hiatus hernia along with mild GERD. So we got the answer. Okay, all right. Now, let's look at the pulmonary referral. DASH and early stage pulmonary fibrosis was ruled out. Were ruled out. What was the condition that was ruled out? Come on.
Asthma.
Asthma, correct. Asthma is correct. Next one. What was the issue that was identified in the patient's lungs?
Hyperinflation.
Hyperinflation. Okay, all right. Next one. Reports being a DASH in childhood. What was he in his childhood?
Passive smoker.
Passive smoker. Okay. And okay, let's listen to that man. Okay, here we go.
To worry about it. But when I mentioned that I was still getting the chest problems, she decided to make a referral to the pulmonologist.
And did you have some tests?
Yes, a number actually. The first one I had showed I didn't have asthma. I didn't really think that I would have, but they explained how they needed to rule it out.
I didn't have asthma. I was sure I didn't have it, but they explained that they had to rule out. So I did not have it, so asthma was ruled out.
I also had a high-resolution CT scan. I think they said they wanted to see if I'd started to show signs of pulmonary fibrosis, but again, that came back clear.
So they wanted to see that they had pulmonary fibrosis, so that was also clear. So again, two conditions were ruled out.
What it did show, however, was that I had hyperinflation in my lungs, and
he had hyperinflation in his lungs.
I came to the conclusion that it was probably mild COPD. I was asked lots of questions about my lifestyle, now and in the past, particularly about smoking. And, of course, my father loved his pipe. So I guess I was a passive smoker throughout my childhood.
I guess I was a passive smoker throughout my childhood. So he reports being a passive smoker. Okay, next one. Joint pain. Initially where? Where was the joint pain? Come on. Knees. Correct. Very good. Next one, analgesia and what else?
Physical
therapy. He says physical therapy. Okay. All right. Next one. What is his job? What is he?
Train driver.
Train driver. He's a train driver. He drives a train. Okay, let's see. Let's listen. I need your full attention. Here we go.
I've never actually smoked myself, though.
That's good. And recently you've been getting other symptoms?
That's right. I've been getting pains in my joints. It was just the odd twinge initially, but it's been getting progressively worse. It started off in my knees, but...
It started off in my knees. So initially it was in his knees.
I'm now getting the same sort of feeling in my wrists and ankles. I've been going to physical therapy and taking painkillers, but I've not noticed any great improvement. But you see, I'm a train driver, so I'm not getting a lot of...
1 second, sorry. I missed out on that. 1 second, yeah.
But you see, I'm a train driver, physical therapy and taking painkillers, sort of feeling in my wrists and ankles. I've been going to physical therapy and taking painkillers.
I've been going to physical therapy and taking painkillers. So see, order. Whenever there is a list, the order is different. See, I told you whenever they add a list with and. The earlier two, it was the same as what's given. But here, this is a list, so the order is different. He said physical therapy first. Okay, order is different. Here. Okay, so I have been to physical therapy and takes painkillers, analgesia. Okay, all right, next one.
But I've not noticed any great improvement. But you see, I'm a train driver, so I'm not getting a lot of exercise, and that doesn't help.
I'm a train driver, so I don't get much of an exercise, so sedentary lifestyle. Okay, all right. Next one. His maternal grandmother had what? Come on. His maternal grandmother had what? Pernicious anemia. Okay, pernicious anemia. Look at the spelling. Next one, his mother has recently been diagnosed with what? Leukemia. All of you go through it. So pernicious anemia, this is the right spelling. If you have written pernicious like this, you will get marks. Okay, pernicious. As long as it's similar to the original pronunciation, you will get marks. Okay, so let's listen. I need your full attention. Here we go.
When I was younger, I used to do a lot of skiing, but I had to give that up after I fell and broke my thigh about 5 years ago. I was lucky I didn't need surgery, but I was out of action for months. At first, I thought the joint pain was related to that, but now it's spreading, I'm not so sure.
And what about the rest of your family? Any health issues there?
Well, my father eventually died of emphysema, and that is a cause for concern. But I should also tell you that my grandmother on my mum's side had pernicious anemia.
I should also tell you that my grandmother on my mother's side, mother's side, had a pernicious anemia. Okay, pernicious anemia. Next one.
I'm aware that there's a family weakness there, on the female side at least, because mum's just been told she's got leukemia.
Mum has just been told that she has leukemia, so we call it. Okay, so this is how you figure out your answers. This is how you approach part A. So tell me, Shravani, Reshma, Soni, Anu, Betty, Anju, Ritu, Jinu, Srividya, Pooja, Sneha, Bibi, Jelmi, Susan, Preeta, Pooja, others. Are you guys clear? Did you get all the answers, or was I able to convey myself why those answers are correct? Do you guys have any questions for me? Please tell me if you have any questions. Come on. Any questions? Any confusions?
Clear, ma'am.
Okay, so get ready. We are moving on to part B of your reading. Okay, sorry, listening. Part B of your listening. Let's go. So in part B, as you guys know, you get 6 questions and 6 audios. And remember, before they play the audio, they read the context out loud. Who is talking to who about what? Then after that, they will give you 15 seconds, 15 seconds of preparation time. During that time, what you need to do is you read your question. Understand what exactly they've asked you to find out, then you read your options. And remember, if your question is a question that ends with a question mark, which means it's a complete question, then just read the question, interpret it, look at the options. But what if your question is an incomplete question, that means it does not end in a question mark. For such questions, read your questions, understand what exactly we need to find out. Then when you read your options, read each option with the question for incomplete questions. And then after 15 seconds, they will play the audio, and as you listen, you need to figure out your answers. Okay, and figure out your answer and wait for the entire audio to end before you mark your answer, because before they move on to the second audio, once our audio ends and before they move on to the second audio, you get 5 seconds. During that 5 seconds, mark your answer, because sometimes when you think one is the answer, towards the end of the audio they might change, so be very careful. Okay, all right, all of you take a second, go through what I've written on the screen and ask me if you have any questions. Come on. Right, let's start with today's audio. Today's first question. I want all of you to pay attention on the screen. Okay, Reshma, can you read the scenario for me, please?
Yes, ma'am. You hear a senior hospital nurse briefing her team about some guidelines.
So here, who is talking to who, Reshma?
Hospital nurse.
Senior hospital.
Talking to her team. About some guidelines.
Some guidelines, okay? Remember, even for your speaking, when you don't say guidelines, it's guidelines, guidelines, okay? All right, so here a nurse is talking to her team about some guidelines. Reshma, now can you read the question for me, please?
The document she is talking about deals with?
The document she's talking about deals with what? Whenever you have a question that ends with deals with what? So you need to figure out what. What is the document? What is the document? Come on.
She's talking.
She's talking about, what is the document she's talking about? Talking about after that?
With guidelines.
She's talking to her team.
Wrong. All of you are randomly saying random things without even knowing what we are doing. I need your full attention here. I already told you, when you have a question that ends with deals with, you can use the question with what to interpret that question. So I've already given you half of the question. What is the document she is talking about?
Guidelines.
Deals with.
Yes. I'm asking you to interpret the question. I'm not asking you to tell me the topic. How do you know what does the document deals with? That is the question, right? So how can you say some guidelines? When I say I need your attention, I need your attention. All of you go through the question, come on. When you have a question that ends with deals with, you can use the question phrase what. But how do you use that in a question? How do you make that? How do you use the word what to make that a statement into a question? Here you can say, what does the document she's talking about deals with? Come on, all of you go through it. Whenever you hear talking about it doesn't mean guidelines. Read the question. Come on, all of you. Come on. Right. As you can see, this is an incomplete question. Reshma, this is an incomplete question. So can you read each option with the question for me, please? Yes.
Okay. The document she is talking about deals with a new policy that is being introduced.
Document she's talking about deals with a new policy that is being introduced. Is that what the document is all about? That it is mentioned, it's dealing with a new policy, a new rule or regulation, or something new, a new policy that is getting introduced. Is that what the document is all about? Next one.
The document she is talking about deals with a health issue that may affect members of staff.
Or is that what the document is all about? Is the document dealing with a health issue, a health problem, a health issue that can affect the members of the staff, that affecting the members of the staff? Last one.
The document she is talking about deals with an aspect of patient care that needs particular attention.
Or is the document dealing with something related to the patient's care, an aspect of patient's care that needs a special attention? All of you go through it. Come on. These are latest material. I need your full attention. Please go through it. Come on. Look at the way that we have interpreted the question. Look at the options. Right, get ready. I'm going to play the audio. I need you to figure out, try to your best to figure out your answers. Okay, here we go.
Track 5.
Let me check the audio first. Tell me whether this is audible.
Test 1, exam practice listening.
Was that audible to all of you?
Yes, ma'am.
Okay, so I'm going to play the audio. Pay close attention. Here we go.
Transmissible. Now, given the ever-increasing risk from transmissible diseases, many of us are being required to wear personal protective equipment, including masks or respirators, much more often, and often for much longer periods. As I'm sure you're all aware, this can result in pressure damage to facial skin, something the hospital's keen both to raise awareness of and to address. New guidelines are in place that advise us how to self-manage skin damage if necessary, including guidance on the care of damaged skin and about appropriate dressings. The guidance also underlines what we should all already know: how to ensure that PPE is correctly fitted, how to make best use of skin barriers or protectants, and the importance of staying hydrated. I'm going to circulate the link so that you're all up to speed on these latest guidelines.
Okay, come on, tell me, what is your answer? What did you guys get as the answer?
A.
Any other answers?
B,
okay, any other answers?
B.
Okay, it is B. I understand why you guys thought it's A, but one second. In our option for option A, they've given a new policy, a new rule or regulation. That's what a new policy is, a new rule, something that's put in place that everybody has to follow, a new rule. Okay, so nowhere in the audio they talk about a rule, they talk about a guideline. That is different. Guideline is something that step by step, one of the steps that somebody has to follow. A policy is more of a rule and regulation. Keep that in mind. Answer is B. Let's listen why B is the answer. I need your full attention. Here we go. I understand why you were confused, so please make sure to pay close attention. Here we go. 1 second. Let me take the audio so we can go through it one by one. Here we go. 1 second. 1 second. Right. Somewhere here.
Does much more. Given the ever.
Get ready.
Now, given the ever-increasing risk from transmissible diseases, many of us are being required to wear personal protective equipment, including masks or respirators, much more often, and often for much longer periods.
So she is like, now given the ever increasing risk from transmissible disease, because of the ever increase or always growing risk from transmissible disease, many of us, so she's a nurse and she's saying many of us, means she's referring to the staff, many of us are needed to wear personal protective equipment, including masks or respirators, much more often, and often for longer periods of time. So considering the risk and increasing risk of transmissible disease, we as staff are needed to wear masks or respirators as personal protective equipment for longer and longer periods of time. Let's see what else she says. So she's talking about staff wearing the respiratory protective devices.
As I'm sure you're all aware, this can result in pressure damage to facial skin, something the hospital's keen both to raise awareness of and to address.
And she's saying, as I'm sure you all are aware of, this can result in what can result in this longer periods of time. They're wearing the respiratory means masks and everything, respirators and masks. So she's like, as you all are aware of, this can result in pressure damage to facial skin. So this can cause pressure damage on our facial skin, something that the hospital's keen means very interested, keen to raise awareness of and to address. So this is something that the hospital wants to create awareness about and wants to deal with. Okay, what is that one thing that pressure damage to the skin when they wear personal protective devices? Okay, all right, let's go. I need your full attention.
New guidelines are in place that advise us how to self-manage skin damage if necessary, including guidance on the care of damaged skin and about appropriate dressings.
She's not talking about a new policy. She's talking about new guidelines are in place. See, we have new guidelines in place, which helps us means the staff, which advise us how to self-manage skin damage if necessary. So if needed. So this facial skin damage that happens, these new guidelines inform us how to deal with it, how to take care of it ourselves, and it includes guidance on the care of damaged skin and about appropriate dressings. So is it talking about a new policy? No, it's a new guidelines that talk about that help the staff manage and apply dressing over the damaged skin. So this is talking about a health issue that may affect members of staff. Let's continue listening.
The guidance also underlines what we should all already know: how to ensure that PPE is correctly fitted, how to make best use of skin barriers or protectants, and the importance of staying hydrated. I'm going to circulate the link so that you're all up to speed on these latest guidelines.
So she's like, the guidelines, she already told it, new guidelines inform us about how to self-manage the skin damage if needed, about the appropriate dressings. Then she's like, the guidelines also highlights what we already know, such as, how to ensure that the PPE is correctly fitted, correct fitting of PPE, how to make best use of skin barriers or protectants, and the importance of staying hydrated. Then she's like, I'll circulate I'll share the link so that you're all able to get up to speed on these latest guidelines. Nowhere she talks about patient care. Nowhere. It's all about taking care of the damaged skin of the staff when they wear PPE. So that's why B is the answer. Just because she mentioned new guidelines, she's not talking about a new policy. A is not, and policy and guidelines are two different things. And she's not talking about one new guideline, she's talking about more than new guidelines. It's plural. So no way A is the answer. Reshma, Soni, Pooja, Shavani, Anu, Betty, Anju, Ritu, Jinu, Preeta, Sneha, Preeti, Susan, Srividya, Jalmi, others, are you clear? Have I conveyed myself clearly to all of you?
Yes, ma'am.
Yes,
Okay,
ma'am.
be very careful. When you hear the word new, you might assume A is the answer. No. Okay, the option, this is wrong. This is completely wrong. New policy, no new guideline. They are two different things. Always remember that. Okay, that this often happens when in where they talk about guidelines, they might give policy. So you might get confused. So be very careful. And if the other way as well, when they talk about policy, they might mention guidelines. You need to be very careful. Okay. All right. Let's go. Next question. Okay. Betty, can you unmute yourself and read the second scenario for me? If that's okay with you? Yes.
You hear a doctor talking to a medical student who is going to observe her consultation with a patient.
So here, who is talking to who, Betty?
Doctor talking to a medical student.
So here a doctor is talking to a medical student, and the medical student is going to observe the doctor's consultation. Her consultation means the doctor's consultation with her patient. So can you read the question for me, Betty?
Why has the patient come to see the doctor?
Very straightforward question. I will be keeping quiet. I want you guys to tell me what exactly have they asked us to find out in the question. This is very easy. Come on. We have done many multiple choice questions. Look at the question.
What is the reason?
The reason for what? Reason for? Whose visit? Whose patient's visit? Very good. Very good. Very good. All of you are correct. Reason for patient's visit. Why has the patient come to see the doctor? Betty, can you read the options one by one for me, please?
Okay, ma'am. He has been having some issues following surgery.
Is that why the patient has come to see the doctor? Because the patient has been having some issues after the surgery. Next one.
He's having some new symptoms.
Is that why the patient has come to see the doctor? Because you know the patient is having some new symptoms. Now, last option.
He's due for a routine health checkup.
Or he came here because he is due for it's time for his routine health checkup. All of you go through it. Has the patient come to see the doctor because he has been having some issues after the surgery? Or has he come to see the doctor because he has been experiencing some new symptoms? Or has he come to see the doctor because he's due for a routine health check? Ready? Get ready. Here we go. Go through the question. Meanwhile, I take the audio. Here we go somewhere here. Get ready.
So what I'm going to do today is a physical assessment of Mr. Jodrell.
Okay.
Mr. Jodrell's a 60-year-old male, and I've already been over his medical history, family history, and medications. Mr. Jodrell has a dairy intolerance and takes statins to control his cholesterol levels.
Right.
About 12 weeks ago, Mr. Jodrell underwent a right colectomy due to ischemic colitis. Since then, he's been recovering well, has no particular concerns, and he's attending today for an annual review that would have taken place anyway. So, I'm going to do a very thorough head-to-toe assessment of Mr. Jodrell, starting with his head. I'm going to be asking him all the standard questions, picking up on any replies that indicate there may be a cause for concern. For example, if he feels any discomfort or tenderness when I palpate or check his articulation, that sort of thing.
I see.
So if you have any questions, I'll be happy to answer them afterwards.
Thanks.
What do you guys think is the answer?
See? See, ma'am.
Very good. C is the answer. C is correct. He's due for a routine health checkup. I'll tell you why. If some of you have not caught the answer, no issues. Let me explain. Pay close attention to the details because, let me take the audio first.
So what I'm going to do today is a physical assessment of Mr. Jodrell.
Okay.
So the doctor is telling the medical student, so you know what I'm going to today is conduct a physical assessment of Mr. Jodrell. Okay? Yes. Jodrell.
Mr. Jodrell's a 60-year-old male, and I've already been over his medical history, family history, and medications. Mr. Jodrell has a dairy intolerance and takes statins to control his cholesterol levels.
Right.
So doctor is like, you know what? He's a 60-year-old male, and I've already gone through his medical history, family history, and medications, and he has a dairy intolerance, and he takes statins to control his cholesterol. Okay, so the student is like, right. So far nothing, right? So let's see.
About 12 weeks ago,
Mr. Jodrell underwent a right colectomy due to ischemic colitis. Since then, he's been recovering well, has no particular concern.
So she's like 12 weeks ago, the patient underwent a right colectomy due to ischemic colitis. Since then, he has been recovering well, has no particular concerns. So A is not the answer. And even B as well, right? We can reject B as well, but let's listen.
And he's attending today for an annual review that would have taken place anyway.
And he's attending today. He has come here today because for an annual review that would have taken place anyway, irrespective of the surgery. This review would have taken place today. So that for that review, he has come here today. So that's why C is the answer. But let's continue listening.
So I'm going to do a very thorough head-to-toe assessment of Mr. Jodrell, starting with his head.
So since he's here, I'm going to do a thorough assessment of his, and I will start with his head.
I'm going to be asking him all the standard questions, picking up on any replies that indicate there may be a cause for concern. For example, if he feels any discomfort or tenderness when I palpate or check his articulation, that sort of thing.
So then she's like, I'm going to ask him standard questions and try to pick, focus on his replies, whether it indicates any cause for concern, like, he feels any discomfort or tenderness. All these things she's saying, I'll ask this, I'll cover this when I do the assessment. And based on his replies, I'll be able to get an idea whether he has any of these problems.
So if you have any questions, I'll be happy to answer them afterwards.
She's like, this is what I'll be doing. And if you have any questions, once we're finished, I'll answer it. That's it. So that's why C is the answer. Pretty straightforward. I'm moving on to the next one. Shravani, can you read the scenario for me, please?
You hear two hospital nurses conducting a patient handover.
So who is talking to who? Two nurses talking to each other. And they're carrying out a patient handover. Can you read the question for me?
What does the incoming nurse agree to for the patient?
What does the incoming nurse agree to do for the patient? All of you, read the question carefully. Tell me, what do we need to find out? Come on.
What does
the incoming nurse agree to do what?
Yes, very good. Incoming nurses agreed action, right? Agreed action. She agrees to do something. What is that? She agrees, she or he, whoever it is, the incoming nurse agreed to do something, agreed action. What is that action? Incoming nurse, okay? Not the nurse who has completed the shift, the nurse who is joining into the shift, okay? All right, can you read the question, options one by one for me?
Arrange for her to see a specialist.
Is that what the incoming nurse is that what the agreement, the incoming nurse agreed to do? That arrange the patient to see a specialist. Next one.
Ensure that she has intravenous hydration.
Or has the incoming nurse agreed to ensure that the patient has intravenous hydration? Last one.
Talk to her about possible triggers for her condition.
So has the incoming nurse agreed to arrange this patient to see a specialist, or has the incoming nurse agreed to ensure that the patient has intravenous hydration, or has the incoming nurse agreed to talk to the patient about possible triggers of a condition? All of you go through the question. I'll play the audio in a second. Get ready. Get ready.
So in bed 4, we have Mrs. Singh, a 65-year-old female. She was admitted last night via the emergency department.
Right.
She'd been woken in the early hours by a sore throat and swollen tongue. She reported difficulty swallowing and her breathing was partially obstructed by the swelling. She also reports esophageal discomfort and she's refusing liquids.
Okay.
There are no signs of a rash, itching, chest pain or nausea and no history of allergic reactions. She couldn't think of anything that might have caused this, though it might be worth running through that again with her.
Sure.
She's been afebrile for me. She was given IV antihistamines and an anti-inflammatory in ED, and the swelling's come down. The plan is for an ENT consult to rule out an abscess or a foreign object, and then a pharmacological review. Those are both in hand.
Okay, what do you guys think is the answer?
A, ma'am. A, ma'am.
A, ma'am.
No, answer is C. Answer is C. Okay. When we say both are in hand, already arranged. Okay. Okay. Both are in hand. Make sure to remember this. Both are in hand. When something is are in hand, something is in hand means done. Arrangements made. Okay. Arranged. Already done. Okay, keep that in mind. Let's listen. I need your full attention. Here we go. Let me take the audio somewhere here.
5-year-old female. So in bed 4, we have Mrs. Singh, a 65-year-old female. She was admitted last night via the emergency department.
Right.
She'd been woken in the early...
Okay, so the one nurse is like, you know what, in bed 4, we have some patient named Mrs. Singh. She's a 65-year-old female and she was admitted last night through the emergency department. So the other nurse is like, right, let's see what the other nurse says again.
hours by a sore throat and swollen tongue. She reported difficulty swallowing and her breathing was partially obstructed by the swelling. She also reports esophageal discomfort and she's refusing liquids.
Okay.
So the nurse who is handing over the shift, she's like, the patient has been woken in the early hours. The patient woke up really early in the morning by a sore throat because of a sore throat and swollen tongue. She reported difficulty swallowing and her breathing was partially obstructed because of the swelling. The patient also reports esophageal discomfort and the patient is refusing liquids. So the other nurse is like, okay, all right, so let's listen. What else? So far, nothing, right? Let's listen.
There are no signs of a rash, itching, chest pain or nausea, and no history of allergic reactions. She couldn't think of anything that might have caused this, though it might be worth running through that again with her.
That is the sentence. Okay, listen to that once again. I'll explain it. Listen to that once again.
And she's refusing liquids.
Okay.
There are no signs of a rash, itching, chest pain or nausea, and no history of allergic reactions.
So earlier they talked about the swelling and they are like the patient refused liquid. So she's like, and the other nurse is like, okay. So the handing over nurse is like, you know what? There are no signs of a rash, itching, chest pain or nausea, and the patient does not have any history of allergic reactions. Then let's listen the next sentence.
She couldn't think of anything that might have caused this.
She couldn't think, the patient couldn't think of anything that might have caused this. The patient cannot think of anything that might have triggered her problem. So let's next sentence.
Though it might be worth running through that again with her.
Sure.
Though, even though the patient cannot think of what caused it, though it might be worth running through that again with her. It might be good to go through that once again with her. Go through what? Asking her what caused the problem. So the other nurse is like, sure. So that's why talk to her about possible triggers of her condition. That's why that is the answer. Okay, let's continue listening.
She's been afebrile for me. She was given IV antihistamines and an anti-inflammatory in ED, and the swelling's come down.
So the handing over nurse is like, you know what? The patient has been febrile for me. She was okay. She did not have any fever, and she was given antihistamines and an anti-inflammatory in the emergency department, and the swelling has come down.
The plan is for an ENT consult to rule out an abscess or a foreign object, and then a pharmacological review. Those are both in hand.
Okay.
So the plan is for an ENT consult in order to rule out any abscess or foreign object, then a pharmacological review. Those are both in hand. Both in hand. Those have been arranged. So not A, not B. So what does the incoming nurse agree to do? To go through that, it might be worth running through that again with her. Running what through that, with her again, what might have caused this? So that's why C is the answer. Are you guys clear? Shravani, Betty, Preeta, Anu, Jinu, Ritu, Soni, Reshma, Anju, others, are you clear? Jalmi, Sneha, Pooja, are you clear?
Yes, ma'am.
Okay.
Clear, ma'am.
Okay. All right. So remember the meaning of in hand, already arranged, already done. Okay, that's what it means. Next one is a very easy one. Okay. All right. So Sneha, would you mind reading the scenario for me, please?
Yes, ma'am. You hear a community nurse visiting an elderly patient in his home. She is going to suggest a reassessment of the patient.
So who is talking to who? A community nurse is talking to an elderly patient. Community nurse talking to a patient during a home visit. All of you read the question. She is going to suggest a reassessment of the patients. So we need to figure out what.
Suggesting what, ma'am?
Suggest, no, be more specific. Suggest, be a bit more specific.
Yes.
What reassessment?
Reassessment of what? Very good. Reassessment of what? Reassessment of what is suggested? Of what? Of the patient. Reassessment of what of the patients is suggested? Is suggested by the nurse. Okay, so the nurse suggests reassessment of something. What is that something? Is suggested by the nurse. Okay, can you read each option with the question for me, Sneha?
Yes, ma'am. She is going to suggest a reassessment of patients. mobility needs.
Is that what the community nurse is going to suggest? The patient reassessment of the patient's mobility needs. Next one.
She is going to suggest a reassessment of a patient's skin integrity.
Or is she going to suggest a reassessment of the patient's skin integrity? Last one.
She is going to suggest a reassessment of the patient's lung injury.
Or is she going to suggest a reassessment of the patient's leg injury? Reassessment of what is being suggested? Is it about mobility needs? Is the reassessment about skin integrity? Or is it about leg injury? All of you go through it. I need your full attention. I'm going to play the audio. Get ready. Get ready.
So, before I put a fresh dressing on, I'm just gently washing your legs to get rid of this flaky skin. That'll keep the new skin healthy. But I'm being very careful not to create any new wounds. Is that okay?
That's fine. I can't manage much myself these days. I hardly ever get out of the wheelchair, actually. I even slept in it one night. And I'm afraid I've not been using that cushion you gave me. It gets in the way when I try to do anything and makes me feel too high up. Could I have a smaller one? Or even a different chair?
Well, we may need to consider that, actually. Your legs are coming on fine, but we don't want you to develop skin problems elsewhere. I'm going to talk to the doctor to see if we can get something sorted out for you.
Thanks, nurse.
Okay, what do you guys think is the answer? Yes, tell
B,
me.
ma'am.
B.
Okay, you might feel B is the answer, but A is the answer. I'll tell you why. A is the answer. Okay, not skin in. Okay, let's listen. Let's listen. Here we go. I need your full attention here.
Flaky skin, legs. So, before I put a fresh dressing on, I'm just gently washing your legs to get rid of this flaky skin. That'll keep the new skin healthy. But I'm being very careful not to create any new wounds. Is that okay?
So the nurse is like, so before I put a dressing over the area, I'm going to wash it to get rid of the flaky skin. That will keep the skin healthy, but I'm being very careful not to create any new wounds. So is that okay? So let's see what the patient says. I need your full attention here. Here we go.
That's fine. I can't manage much myself these days. I hardly ever get out of the wheelchair, actually. I even slept in it one night.
So he's like, yeah, that's fine. Do what you got to do. That's fine. And he's like, you know what? I cannot manage myself these days. I hardly ever get out of the wheelchair. I rarely get out of the wheelchair, actually. And one night, I even slept on the wheelchair. Then let's see what he says.
And I'm afraid I've not been using that cushion you gave me. It gets in the way when I try to do anything and makes me feel too high up.
So she's like, and he's like, you know, he talked about how he cannot do anything on his own, how he hardly ever get out of the wheelchair. One night he even slept on the wheelchair. Then he's like, I'm also afraid that I've not been using the cushion that you gave me. It always gets in the way when I'm trying to do anything, and it makes me feel, you know, too high up. So she has given him a cushion to use on the wheelchair, but when he uses it, it is getting in his way, and he feels he's too high on that cushion. So let's see what he says next.
Could I have a smaller one, or even a different chair?
So he's like, so can I have a smaller cushion, or can I get a different chair? Can I have either one of this? Then let's see what she says.
Well, we may need to consider that, actually.
We may need to consider that, actually. Consider what? Giving another cushion or changing the wheelchair? We may need to consider that. We may need to take into consider that, actually. So consider means, you know, think about that again. So he already has a wheelchair. She gave him a cushion. He's not able to use the cushion, and he's spending way too much time on the wheelchair. So, and he asked, like, can I get a smaller cushion, or, you know, can I get a different wheelchair? So she said, I think we may need to consider that. Consider what? Changing the cushion or giving him a new wheelchair. So that's related to his mobility. Let's wait.
Your legs are coming on fine, but we don't want you to develop skin problems elsewhere. I'm going to talk to the doctor to see if we can get something sorted out for you.
So she's like, see, so your legs are coming on fine, it's fine, but we don't want you to develop any skin problems elsewhere. So I'm going to talk to the doctors to see if we can get something sorted out for you. Something related to what? Something related to his wheelchair. Not because she wants to take care of she wants to consider his cushion and wheelchair again in something related to that. So he does not develop any other skin problems. And so that's why she's like, I'm going to talk to the doctor so we can sort something out. Sort what out? Either give him a small cushion or a smaller cushion, or give him a new wheelchair. So that's why D, A is the answer, not B, not C. The focus is not on the skin problems. Skin problems can happen related to what? He is struggling with the use of his wheelchair. He wants them to either give him another cushion or give him a different wheelchair. So she said, we'll consider that. We'll think about that again. So they've already given something, so they will think about it again. I will take that into consideration. You have no other problem right now, and we don't want you to develop any other problem related to your skin. So I'll see what I will talk to the doctor and sort something out. Sort something out related to what? Related to his wheelchair. So that's why A is the answer. Related to his problem. His problem is not the skin. The problem is the cushion or the wheelchair. So if they don't do something, she's saying we need to do something. Otherwise, you may develop some skin problem. So we will sort something out. I'll talk to the doctor and we will sort something out not related to skin integrity. So they will consider everything again, the wheelchair, different wheelchair or a different cushion. So that's why A is the answer. Shravani, Betty, Sneha, Anu, others, are you clear? Reshma, Soni, Jinu, are you clear? Why A is the answer? Have I conveyed myself clearly? Yes. Okay. We have 2 more questions to go. Let's look at the next question. Soni, can you unmute yourself and read the scenario for me, please?
Yes, ma'am. You hear part of an induction program for new members of clinical staff at a hospital.
So here you're going to listen to an injection program for clinical staff, new members of clinical staff. So somebody is conducting an orientation or an induction program for new members of clinical staff at the hospital. Can you read the question?
The session on electronic medical record is going to focus on.
All of you read the question. The session on electronic medical records is going to focus on. So we need to find out what? Easy, right? Take a second, pause and read the question and tell me what have they asked you to find out.
Electronic medical records. The session electronic records is going. What is the
focus?
What is
Very
the
good.
focus?
Focus of the session on. So they're going to give a session on electronic medical record, electronic medical record. So what will be the focus of that session? What will be the focus? Okay. All right. That's not the electronic focus of the electronic records. Session on electronic medical records will focus on what? Okay. All right. Can you read each option with the question for me, please?
The session on electronic medical record is going to focus on familiarization with the system.
Is that what the session is going to focus on? To get them familiarized with the system, make them familiar with the system. Next one.
The session on electronic medical record is going to focus on how to avoid errors in the system.
Or is the session on medical records going to focus on how to avoid errors in the system, how to get rid of errors in the system, how to stay away from errors. Next one.
The session on electronic medical records is going to focus on linking medical devices to the system.
Or is it going to focus on connecting medical devices to the system? So is the class or session that they're giving about electronic medical records focusing, or is it going to focus on familiarizing them with the system, or is it going to focus on how to avoid errors in the system, or is it going to focus on connecting medical devices to the system? All of you get ready. This is the second last audio. I need your full attention. Here we go.
Okay, so this morning we're looking at the hospital's electronic medical record system. Now, I expect you've used similar systems before, but you need to engage with the specifics of ours and be totally on board with its functionality. So that's our aim today. A key feature of this system is that you've got a single sign-on for most applications. You just enter your username and password once when you log in, rather than each time you use a separate application. Now, this makes life easier and means you get to spend time with your patients rather than staring at a screen. On top of that, some medical equipment's already integrated into the system. This is great from a patient safety perspective because there's no need to transfer data from one machine to another, so you avoid those inevitable slips where you type a digit wrong and don't notice.
Okay, What do you guys think is the answer? Come on, tell me what do you guys think is the answer? Yes?
A, ma'am.
Correct. A is the answer. A is correct. Yes, A is the answer. Let's listen. Let's listen. I need your full attention. Here we go.
Okay, so this morning we're looking at the hospital's electronic medical record system.
So he's like, you know what? Today we are going to have a look at the electronic medical system of the hospital.
Now, I expect you've used similar systems before, but you need to engage with the specifics of ours and be totally on board with its functionality. So that's our aim today.
That's a sentence that gives us the answer. I expect you have used similar systems before. I believe you have used something like this before. However, you need to engage with the specifics of ours. You need to get used to the specific parts of our system and be totally on board and completely familiarize yourself with its functionality, how it functions. Be totally on board, totally aware of how its functionality, how it functions. So that's our aim today. So that's why A is the answer. He says, I'm sure that you've used something like this before, but you need to engage with, we need to connect with the specific aspect of our system and be totally on board with its functionality and be totally aware of how it functions. So that's our aim today. So that's why A is the answer. Let's continue listening.
A key feature of this system is that you've got a single sign-on for most applications. You just enter your username and password once when you log in, rather than each time you use a separate application.
So he's like, the main feature of the system is you just have to sign in once for most appliances and you just enter your username and password, and once when you log in password once when you log in, rather than each time you use a separate application. So every time you use an application, you don't need to log in every time. You just need to log in once. That's enough.
Now, this makes life easier and means you get to spend time with your patients rather than staring at a screen.
So you don't need to type in every time you use a device, so you can spend more time with the patient, so it becomes easier for you.
On top of that, some medical equipment's already integrated into the system. This is great from a patient safety perspective because there's no need to transfer data from one machine to another, so you avoid those inevitable slips where you type a digit wrong and don't notice.
So yes, B and C are mentioned. How they say, you know what? On top of that, some medical equipments have already been integrated into the system. We have already connected some of the medical equipment here to the system. This is very good from a patient's safety perspective because you don't need to transfer data from one machine to the another. So you, from one machine to another. So you avoid those slips, those errors where you type a digit wrong and don't notice. So B and C are not the focus. They do mention B and C, but they say the systems are already connected. Some equipments have already been linked to the device. Okay, they link to the system. So this way, so every time you repeat the patient, you don't have to transfer data from one machine to the other. It's already done, so that way you can reduce error. But nowhere they say that is the focus. So B and C are mentioned, but that's not the focus. So the focus is they want them to get engaged with the specific of their system and be totally on board with its functionality. That's our aim today. That's our focus today. So that's why A is the answer. B and C are mentioned, but that's not the focus. Okay, are you guys clear with this question? Shall I move on to the last one? Anju, Reshma, Srividya, are you clear? Bibi, are you clear? Okay,
Clear.
last question. Anu, can you read the scenario for the last one?
You hear part of a briefing meeting for staff in a local health center.
So you're going to hear a meeting for staff, briefing meeting for staff in a local health center. Okay, so in a health center, they're conducting a meeting and we are going to listen to that. Anu, can you read the question for me?
The patient being discussed needs nursing help to learn how to.
All of you read the question and tell me, what do we need to find out? The patient being discussed. So the patient they're discussing needs nursing help to learn how to. So we need to figure out what? Patient. Learn, is it about learn? Who learning what? Go through it. The patient being discussed. So that means they're discussing a patient. Needs. So that patient needs nursing help, the help of the nurses to learn how to. So we need to figure out what?
What the patient needs to learn.
Mm-hmm. The patient needs. I need others as well. The patient needs
The patient needs to learn-
nursing help.
Nursing
Nursing help. Mhm. To learn.
How to
learn
To learn how to do what? How to do what? So the patient needs to learn something, how to do something, and how to do what? To learn how to do what does the patient need the nurse's help? All of you go through the question. The patient being discussed, so they are discussing a patient who needs nursing help. That patient is in need of the help from the nurses to learn how to do what. So the patient needs help from nurses to learn how to do what. Okay, so Anu, as you can see, it's an incomplete question. Can you read each option with the question?
The patient being discussed needs nursing help to learn how to change her own dressings.
Is that what the patient needs help with? To learn how to change her own dressings. Last one and second one.
The patient being discussed needs nursing help to learn how to self-administer her medication.
Or is that what the patient needs help with? How to learn how to administer medicine on their own. Last option.
The patient being discussed needs nursing help to learn how to cope up with her activities of daily living.
Or does the patient need nurses' help to learn how to cope with her activities of daily living? So does the patient need help with changing her own dressing? Does the patient need help with self-administer her own medication? Or does the patient need help with cope with her own her activities of daily living? All of you get ready. I'm going to play the audio. Get ready. Here we go.
So, Mustafa, tell us about any patients being discharged from hospital this week.
Well, first up, we've got Elaine Stokes, a 67-year-old female who was admitted following a fall, but who's now fully mobile. But she has vascular wounds on her feet that need to be dressed daily. She's had a procedure to improve her circulation, so won't need that doing long term.
Okay, so we're providing home visits?
That's right. We're doing that because another thing the patient needs is eye drops 4 times a day to treat bacterial conjunctivitis. Our main goal is to get her to use an auto dropper to reduce the number of visits. She's not keen on the idea, but whoever goes needs to be moving towards that. For the first few days, she'll be cared for by her son, just until she gets used to being back in the home environment, and hopefully we'll have his support.
Okay, what do you guys think is the answer? Tell me, what do you guys think is the answer?
C, ma.
It's not A, it's not C, it's B. It's B, ma'am. It's B, it's B. I need your full attention. All of you said A or C. Let's listen. Here we go.
So, Mustafa, tell us about any patients being discharged from hospital this week.
So she is talking to Mustafa. I mean a staff there. So she's like, Mustafa, tell me about the patient who is leaving the hospital this week.
Well, first up, we've got Elaine Stokes, a 67-year-old female who was admitted following a fall, but who's now fully mobile. But she has vascular wounds on her feet that need to be dressed daily. She's had a procedure to improve her circulation, so won't need that doing long term.
So she asked like which patient is going home this week. So he's like, well, first we have got somebody named Elaine Stokes, who is a 67-year-old female who was admitted here after a fall, but who is now fully mobile. She can walk now, but she has vascular wounds on her feet that needs to be dressed daily, and she has had a procedure to improve her circulation, so she won't be needing this for the long term. Okay, so she needs someone to change her dressing because on the vascular wounds, she already has had a procedure to improve her circulation. So she will not need this for the long term.
Okay, so we're providing home visits?
That's right.
So she's like, okay, we are providing home visit to the patient. Is that right? So he's like, yes, that's right.
We're doing that because another thing the patient needs is eye drops 4 times a day to treat bacterial conjunctivitis. Our main goal is to get her to use an auto dropper to reduce the number of visits.
So yes, she has vascular wounds on her feet that needs to be dressed. So that is not something they have to teach her. Do they need to change her dressing? Yes. But should they teach her on how to change her own dressings? No. Okay. They just need to change her dressings. That's it. They have not told that they have to teach her to change her own dressing. So that's not it. So, but then she asked, so we are providing home visits. So he's like, yes, that's what we are going to do. We are doing that. We are giving her home visits because another thing that the patient needs is eye drops 4 times a day to treat bacterial conjunctivitis. So the patient has bacterial conjunctivitis and the patient needs eye drops 4 times a day. So that is the thing. That's why they are sending someone home, someone to visit the patient. Our main goal is to, so their main goal is to get her, make the patient to use an auto stopper. That's their role. Help the patient to do it on her own, to use the auto dropper to administer the medication. That will help us to reduce the number of visits. So we can reduce our number of visits. Okay, let's continue listening.
She's not keen on the idea, but whoever goes needs to be moving towards that.
Patient is not really keen on that idea, but whoever is visiting her needs to do something to move towards that. Towards what? Get the patient to use the dropper on her own.
For the first few days, she'll be cared for by her son, just until she gets used to being back in the home environment, and hopefully will have his support.
So he's like, patient is not interested. So whoever is visiting needs to get her move towards that, towards using the auto dropper on her own or to administer the medication for a bacterial conjunctivitis. Then he's like, you know what? For the first few days, her son will be taking care of her. So until she gets used to her home environment, not activities of daily living, home environment. Until she gets used to the home environment. So, and hopefully we will get support from the son as well. So that's why B is the answer. So yes, are they going to change her dressing? Yes. Do they want her to learn how to change her own dressing? No. But what do they want her to learn? To self-administer the eye drops for her bacterial conjunctivitis. And she's not interested in it. Okay. So he's like, her son will be taking care of her for a few days. So hopefully we'll get help from him. So that's why B is the answer. A is not the answer. C is not at all mentioned. They say her son will be taking care of her until she gets used to the home environment, not activities of daily living. Okay, so that's what that is. Are all of you clear? Shravani, Betty, Anju, Anu, Reshma, Bibi, Srividya, Pooja, Sneha, Preeta, Soni, others. Are you clear? Do you have any questions for me?
Clear, ma'am.
So I'll send you this material. I'll send you a plain copy. Make sure to go through this once again. And if you have any questions, get back to me. Evening 5 o'clock, we'll be doing an interview. Last week, we focused on presentation. This week, we'll be having a look at an interview. So that's it for today. I'll see you guys in the evening. Thank you for joining me. Okay. All right.
Thank you, ma'am.